marching for a loving world. One more time. Ain't gonna let nobody turn me around, turn me around, turn me around, and I will let nobody turn me around. Keep on talking, marching to the freedom land. Just have to keep on walking, keep on talking.
Together. We can do anything together. But we got to be together. And then when we get together, we're going to stay together. Let's sing this again. Sing that. Will you walk? Please keep talking. There's still a lot of work to do. There's a lot of work to do. Washington, freedom,
this music is so shaking music like that has compelled the civil rights fighters and the Underground Railroad folks who were going through the Underground Railroad, that there would be a brighter day. Even in the midst of darkness, it was Dr. King that said, even in the darkness, the stars shine bright. And certainly we have a lot of crises happening in our world today that are interlocking. We have a crisis of violence across our cities in America and across the world. We have the climate crisis. We have a healthcare crisis. We have so many crises that are interlocking. But I am convinced that change is not inevitable, but it only happens when people of goodwill, people of moral conscience, people of faith, people of no faith, get together and say enough is enough. When the peace activists connect with the racial justice activists, connect with Black Lives Matter activists, connect with human rights activists, together with y'all. Well, I have the distinct pleasure of bringing up Cole, who will introduce our wonderful keynote speaker. And I've had the chance of knowing the keynote speaker, Katie Murphy, for quite some time now. We worked together on the Yes on One campaign for safe patient limits, along with Vernon back there. And, and nurses are still fighting. And I think if this pandemic has not taught us anything, it has taught us who's essential and who's not essential. Who's critical to the survival of our economy, who's critical to the survival of our human health, and who's not critical to the survival of our economy and the survival of our human health. Who would have thought that grocery workers would have been considered essential workers before the pandemic, but the pandemic spotlighted how important and essential grocery workers are in this pandemic. So anyway, I'm going to bring up Cole, and he has the privilege of introducing Katie, and I'm sure you are in for a treat, so hold on to your seats, and it's going to be a wonderful ride.
Thank you, Vernon. For everyone, it's great to see everyone here tonight. I'm so excited that we are all gathered together, coming home. We're not through COVID, but we're trying to hang in there and trying to stay together and trying to gather together. Vernon called out the essential workers, and there's no workers that were more essential in the age of COVID than nurses. They're the ones who pulled our people through. And yet they are on strike at St. Vincent's Hospital for more than 6 months in Worcester. This is a rapacious private corporation that has privatized hospitals and is squeezing and squeezing and squeezing. And we wish those St. Vincent strikers the best in their struggle for justice. The mass nurses were behind the safe staffing levels referendum that was on the ballot a couple of years ago. We joined in that fight. Unfortunately, we were not successful yet, but we're going to keep on supporting that issue. Mass Nurses is one of the key champions for single-payer healthcare in the state and in the country. If COVID taught us anything, it's that we need the fundamental human right to healthcare.
Thank you.
We need a system where everyone's in, nobody's out. We need a single-payer system in Massachusetts and nationwide. The COVID era has also taught us that our nation's priorities are so far off. We are wasting our resources in endless wars. How many trillion do you think we wasted in Afghanistan?
21 trillion.
Thank you, Bonnie. We wasted 21 trillion. That's with the T. I mean, we've been working to understand what a billion is, but now we're dealing with 21 trillion that we wasted. And what do we accomplish in that war? Absolutely nothing. And we're back to square one. And meanwhile, our frontline workers didn't even have PPE. We didn't have enough ventilators. We didn't have an organized system, and we still haven't distributed those vaccines to the rest of the world. So this is just a tragic misallocation of resources that we must correct. So we have a Fund Healthcare Not Warfare campaign, and we're very happy to recognize Katie Murphy as one of the spokeswomen for that issue. And nurses are also part of the broader struggle for working people in the state, in the country, and across the world, as we struggle for justice from so many forms of oppression and inequality. So without more ado, I am here to present the 2021 Peace Leadership Award to Katie Murphy, elected president of the Mass Nurses Association.
Those are some very, very impressive titles. They really are, and I'm honored. And as
Give us some process.
okay, I'm going to grab my notes in my
Okay,
day.
we'll let you go.
Thank you so much. I appreciate it. All right, let's go. Can I put that there? Is that okay?
It is.
Oh, hi, everybody. Thank you so much. And thanks so much for having me here tonight. I really do believe I am among giants. So thank you so much. You know, I have to say, you know, about earlier this year, I participated in a fund, healthcare not warfare, you know, and I felt very pleased to be, you know, having this conversation with dedicated activists. And then, you know, I was invited to participate, you know, in this event tonight. So, you know, I did my due diligence, you know, researched, you know, the Mass Peace Action team. And I thought, okay. Well, I cut my teeth on activism in the anti-Vietnam War protests in New Jersey. I wondered, what will I talk about with this august body who has already written prize-winning books and led global initiatives in these activities? So I thought, you know, I looked at the work that's being done by Mass Peace Action, nuclear disarmament, forever wars and apartheid, racial justice, climate injustice. And I thought I'd talk about how those issues affect our patients every day and how this affects the healthcare workers providing care to our patients, who are our neighbors, our friends, they are us. A few words just about who the Massachusetts Nurses Association is. Since its founding in 1903, the Massachusetts Nurses Association has been the most powerful and effective voice on nursing and healthcare in the Commonwealth. We created the Nurse Practice Act, the RN license designation. We developed a uniform curriculum for the education of nurses. We wrote the first code of ethics for nurses and passed or helped to pass nearly every state law governing nursing practice, including the law allowing nurses to unionize in Massachusetts. Anyway, today we are the largest union and professional association of registered nurses and healthcare professionals, because we do have other healthcare professionals in the state, and the third largest in the nation, representing more than 23,000 members in over 85 healthcare facilities, as well as a growing number of nurses and health professionals working in schools, and that's a story for another day, visiting nurse associations, public health organizations, and state agencies. The M&A is a one-member, one-vote democratic organization where the members set the agenda. An elected board of directors is made up of frontline nurses and healthcare professionals across the Commonwealth. And then we have the opportunity to address local issues and to mobilize within our own communities through 5 regional councils. No matter where nurses practice or what the populations they serve, the M&A has the tools, the resources, and the support nurses need to be the best they can be and to ensure that patients receive the care they deserve. I want to just talk briefly the 5 kind of foundational principles of the Mass Nurses Association, which really does inform our work. Work for improvement and availability of healthcare services for all people. Foster high standards of nursing practice, education, and research. Promote the health and safety of nurses. Act and speak for registered nurses in Massachusetts, and foster involvement by registered nurses in the political process to shape sound health policies. I'm going to break that down a little bit. We're active in our hospitals, our communities, our neighborhoods, local organizations, and state and national organizations. We identify needs in every area. Is it an underserved neighborhood? Is it a statewide or national issue like unequal access to care or to a facility? Is it the safety of patients and healthcare workers that is in jeopardy? It was with growing alarm that we watched the state, as well as hospital systems, close services and even entire hospitals. Over the past decade, we've lost at least 40 hospitals or hospital units, and that number probably is different today. These have been maternity services, pediatric services, and mental health services. Many are creating healthcare deserts. It's important to recognize that the Department of Public Health in Massachusetts has ruled these hospitals and services are essential in case after case, and yet they closed. Many of these closures occurred in parts of the state with minimal or no public transportation. Our most vulnerable communities are affected. Rural, low income, underserved immigrants, and communities of color are disproportionately affected by losing these services. The current issue highlights the urgency of collective action. I work at the Brigham and Women's Hospital. It's a terrific institution. We do cutting edge oncology research. We do reconstructive surgery. We successfully bring tiny lives into the world. And every single day and night, we save lives. It's a great place to work. But the corporation of Mass General Brigham or Partners or MGB, whatever its name is today, would like to build 3 outpatient surgery centers in 3 affluent suburbs, Westboro, Woburn, and Westfield, areas that are currently served by local smaller institutions. As a union, the M&A is usually across the table from hospital CEOs and management, but in this case, we find ourselves sitting in the same pew. Due to the for-profit healthcare in this country, hospitals are reliant upon private paying patients to subsidize services for our neighbors on Medicaid and Medicare. Thus, if these centers are built, they will impact the financial ability of critical safety net providers in these areas and further impact negatively access to care. These communities rely on their local clinics, hospitals, and services for their ongoing health care and physical and mental health needs. In the hearings before the Department of Public Health earlier this year, the testimony was wide-ranging and heart-wrenching. The massive UMass system, as well as small, local, multilingual organizations, spoke passionately about the specter of closing their units. And even a hospital such as Marlborough Hospital or Lawrence General, if the surgical centers moved in and claimed patients, physicians, employees, and most critically, dollars. Local institutions also employ local people, which creates stability in the area. Transfer of these positions to current MGB employees will further destabilize already challenged communities. We also don't anticipate that these will be union jobs, decreasing the voice of workers in their place of employment and having an impact on their working conditions. Maternity services have been targeted by corporate medicine. In February of this year, we released a position paper entitled Massachusetts, Maternal Services Are Central to Racial and Social Justice. And I have to say that paper has been used by legislators as they're addressing these issues on Beacon Hill. The M&A identifies access to reproductive care, including maternity and birth-related services, as essential to racial and social justice. And these services, again, have been cut in communities that are overwhelmingly poorer and communities of color. You know the statistics. Non-Hispanic Black women are 3.3 times as likely to die from a pregnancy-related cause compared to non-Hispanic white women. I think the most recent number I saw for the Defense Department budget for 2022 is $715 billion. I think maybe it's $750 billion. I mean, that is a stunning number when we look at the shape of healthcare in this country. Over the recent past, we've heard the chant, no justice, no peace. I particularly like that one. But I saw it written differently one day. No justice, no peace, with the N-O spelled K-N-O-W. No justice, no peace. And that actually felt more empowering as it pointed a way towards positive action, although I fervently believe the former spelling. Our collective voice, our finding common cause, our identifying solutions can move mountains. Maybe one pebble at a time, but move it we will. These goals of working with our local communities informs the relationships we strive to establish and nurture, not only with policymakers, but with community activists. In this way, our efforts align with those we seek to serve. The needs of our citizens in the rural western part of the state differ from those in more urban areas, and we need to know the local leaders and listen to them and learn their needs. We have filed legislation that addresses the closure of these essential services in Massachusetts. We at the Massachusetts Nurses Association believe that healthcare is a fundamental human right. Keeping yourself or your family safe and healthy shouldn't depend on the color of your skin, your gender, your sexual orientation, your job status, where you live, or the amount of wealth you have accumulated. In the richest nation in the world, these should not be barriers to accessing high-quality, inclusive healthcare.
That's right. That's right.
We see it everything. M&A nurses and healthcare professionals support Medicare for all because it will eliminate these artificial barriers, reduce costs, and save lives. We see the impact of people not having the policy of Medicare for all at our bedsides literally every day. Patients come into Massachusetts hospital facilities far more acutely ill than they would have if they had insurance or more comprehensive coverage. High copays, deductibles, and inadequate prescription coverage can have the same effect as no insurance at all. A diabetic whose health could have been managed through regular doctor's visits and medication ends up in the emergency department with vision loss or kidney failure. And we know what emergency departments look like these days, right? You can't get in. Someone with high blood pressure who can't afford their medication must undergo dangerous and expensive cardiac surgery. Untreated mental health and substance use disorders land far too many people behind bars rather than under specialized care. Without Medicare for all of us are at the mercy of escalating healthcare costs. The budgets of local and state governments are overwhelmed by insurance expenses. Workers face terrible choices. Change your job and lose your health plan. Employers force unilateral cost hikes onto non-union workers. And unionized employees have to confront proposed health insurance increases while we're trying to negotiate safe and fair working conditions. Increasingly, bargaining healthcare costs shifts the focus of our nurses and healthcare professionals away from critical issues such as patient safety, a quality work environment, or fair wage increases. Our existing healthcare system leaves tens of millions of Americans behind. It inflicts bankruptcy on vulnerable families and contributes to negative patient outcomes while enriching a select few. We have to stop profiting off patients' health and instead ensure every person can afford to seek quality care. Medicare for all will reduce administrative and prescription drug costs and mitigate the need for complex interventions for people who will be able to proactively take care of their health for themselves and their families. Although we've been slightly preoccupied over the past 18 months, we continue to fight for universal health care both locally as members of Mass Care and nationally with the labor campaign for single payer, among others. All the inequities of our system were thrown into stark relief by the global pandemic. A quick look back at March 2020, those first confusing, frightening days of the pandemic. We didn't know what we were confronting or how to confront it. I spent 15 months of the pandemic running a COVID ICU at night. I saw unspeakable pain and loss, as well as tremendous acts of love and heroism. But one of my earliest recollections is looking at my patient census those first couple of nights and saying to myself, Rodriguez, Manuel, Garcia, why are all my patients Latinx? Overwhelmingly, the face of the pandemic was brown. In case one didn't think there were health inequities, didn't think that living in a community surrounded by smoke-belching industry, ancient buses, and ill-ventilated housing were life-shortening, take a look at our patients. I also think that I was incredibly fortunate to work in a union facility. In the first place, we had fought for safe limits on patient assignments for years, so we started out in a better place. This isn't to cast aspersions on those who still fight this fight, but I know we were safer than so many of our sisters and brothers on the front lines. There was at least one hospital where the pandemic placed healthcare workers in such danger, and I mean life-threatening situations, that they joined the Massachusetts Nurses Association. Welcome, Milford Regional Medical Center. In union facilities, we had channels to address and fight for our patients, for PPE, and for resources that hospitals often had under lock and key, and to keep our communities as safe as we could. Many of us who were at the table for negotiations voluntarily put them on hold during the pandemic. We paused our work to improve working conditions, to put all our time and effort into saving lives. One example is the nurses and the post-anesthesia care unit at St. Vincent Hospital. Those nurses took it upon themselves to turn their recovery room, their post-anesthesia unit, into an intensive care unit so that the regular intensive care unit could convert to an all COVID intensive care unit. Nurses offered to leave their assigned units and move to where the need was greatest. In return, when the M&A nurses of St. Vincent Hospital returned to negotiations mid-2020, Tenet, the Fortune 100 Dallas-based investment corporation, thumbed their gold-plated noses at those heretofore heroes and refused to negotiate decent, simple, safe patient limits and resources for the patients, the citizens of Worcester. After working tirelessly, the nurses, committed to patient safety, took a strike vote and walked out of the hospital on March 8th. 6 months ago. The longest, they're my heroes, that's for sure. The longest nurses strike in Massachusetts history. We know that care has suffered. We know there have been injuries and at least one death. Tenet has spent over $110 million in counting to prolong the strike. It seems like we keep coming back to the subject of patients over profits. Our sisters and brothers in the labor movement have been steadfast in their support, walking the line, making calls, contributing to the strike fund. Most of our elected and appointed leaders have been to the line and called everyone from P-Town to San Francisco and back again in an effort to resolve the strike. This is an attack on unions, make no mistake, and we are determined to stay there. One day longer, one day stronger. Years ago, when we were collecting signatures to put our safe patient limits on the ballot, we were also collecting signatures for a bill that called for transparency in hospital CEO salaries. I have to say, this often garnered more attention and enthusiasm than our bill. But you know what it really shows that regular taxpayers were concerned about fairness and equity in financing, even if every arcane point isn't understood. And it is our fervent belief in this fairness that is supporting the Fair Share Amendment that Raise Up Massachusetts is championing. We at M&A have nothing against people making a good wage. After all, we spend a lot of our time at the table on just that issue. But our members pay our taxes. And those in the 1% whose income skyrocketed and who saw tax cuts over the past several years can well afford to give back to their communities. This really only touches on subjects and issues that we M&A nurses hold dear and continue to work on. I look at the work that you do, and I look at the work you are doing. Your collective hearts and minds are addressing the fundamentals that will affect the health of my patients. We live in one of the wealthiest areas in the wealthiest nation on earth, yet we have communities in the Commonwealth that rival Appalachia in poverty. I sometimes look at my patients and wonder, how do you eat? The work of Mass Peace Action seeks to make that question disappear. That someday I won't look at my 19-year-old cancer patient from Springfield or my 80-year-old patient from the Cape and ask that question. And for that, I am profoundly grateful. Thank you. Yeah, sure. Sure.
So you want to announce it?
Yeah, so are there any questions? I can't promise I'll know the answers, but I bet the questions will be thought-provoking. Yes.
You know, hospitals need private nonprofit. They have nonprofit status, but yet physicians get these things. I think there's a whole lot of problems out of
The question was that in both profit and nonprofit hospitals, physicians can be sued. Was that? I'm sorry.
I think they're classified as nonprofit hospitals.
Right.
And should be classified as physicians. They're earning a lot of money.
And billions of it are offshore. So when hospitals cry poor mouth that they can't provide enough nurses or enough PPE or enough resources, we say, what about that bank account in the Cayman Islands? And they say, I can't hear you, but the money is in healthcare. We have the resources to provide the care that everybody deserves.
And we have a mic going around if anybody has a question. So if you have a question, I'll bring the mic to you. Sure, Katie would be happy to answer.
Or try to.
All right, here you go. Testing.
Yeah, that's good.
What's the latest from St. Vincent's?
Thank you so much. So, we're really pretty close. We're really pretty close. The nurses have stayed very strong because certainly the conditions inside the building were bad. It was unsafe for patients. It really was. While, at the end of either the last quarter of 2020 or the first quarter of this year, Tenet posted a $400 million profit.
Wow.
And also received $3 billion from the federal government to the CARES Act, which I'm pretty sure is my money, your money. Okay. So we're pretty close. It's just that we have just kind of one sticking point going back into the building, and tenant just, there's no other way to say it. They are just retaliating. They are retaliating and refusing to give nurses back the positions that they were in when they walked out. So we're pretty close, but that's, you know, we walked out together and we'll walk back in together. Thank you.
Any other questions? All right.
I would ask, my name is Greg Moy, I would ask, why doesn't the Mass General Hospital purchase St. Vincent's Hospital, take it over? Just tell them, leave Massachusetts. We don't want you here. Let Mass General Hospital take over the hospital, buy the hospital. Just Massachusetts can buy that hospital. And I was up on the picket line at St. Vincent's, I just wanted to add that. So they could do that. So why don't we do that? You know, why don't we just buy it?
So I know, you know, and as I, you know, I think it's working at the Puma is really wonderful. Like the Mass General, these are wonderful, wonderful hospitals, but you know, their corporate side is, I think, showing itself to be almost as evil as Tenet. But you know, remember a couple of years ago when the Mass General partners wanted to acquire South Shore Hospital. Maura Healy, the AG, nixed that because of monopoly. But certainly many people have said the same thing. You know, Tenet, you don't like this, you don't want to deal with unions, leave the state. That would be, you know, put those healthcare decisions back in the hands of the community, which it serves, right? So,
I'm sure Maura Healy will vote for that.
I hope, yeah.
I'm sure she will.
Well, we will see. We will see, right?
Just wondering, is there anything that ordinary citizens can do to help support the St. Vincent nurses for that last stretch?
Thank you so much. And ordinary citizens have been helping the St. Vincent nurses from day one. From day one. You know, right now, I think being on the picket line is probably one of the most important activities. I mean, even if you know, it's an hour, I've been there as little as 20 minutes. You know, just like whenever you can fit it in, because right now, you know, the nurses, because they went 9 weeks without a paycheck and now their unemployment has run out. So they're getting, you know, part-time jobs, per diem jobs in other hospitals. So there are times when the line's a little thin. So if you can get out there and bring a friend, I mean, especially in the nice weather, you know, just taking a, you know, walk back and forth, you know, it's I think it's energizing, you know, to talk to, you know, being on a picket line, especially for, you know, a righteous strike such as this. So anybody, you know, grab a friend, even going out for an hour. You know, I think the nurses are feeling some pressure to cover the line while they're also trying to fit in per diem jobs, you know, all over the state. So thank you for that question. That would be a huge help.
Any more questions? We got two here.
Hi. Do you know if there are any efforts to build sort of cooperative hospital infrastructures in the community, or is that something that the union is exploring or interested in?
You mean it's in Worcester or just generally throughout the Commonwealth?
Just generally in Massachusetts, similar to the model that's happening in Brooklyn.
You know, I don't know of one right now. I really don't, but you know, it's a very important thought. And I think that, you know, as we eventually resolve the strike, I think that there will be a lot of important questions, and that might be one of the answers. Thank you.
Serena Mehmet again. In 2018, there's question 1 on the ballot about nurses getting the fair rights to work, and I know that some nurses were against it and some were for it and failed, but I thought I remember seeing that the nurses union was gonna work with the state legislator or state government, and I was wondering how that was going. They didn't.
Well, let me see. So, no, thank you for that question, you know, and it was to, you know, set safe patient limits. Right now, California is the only state, and actually, most bedside nurses supported it, but, you know, a lot of the hospital association put their managers in scrubs who said, oh, just think if there were a limit on the number of patients a nurse can care for, think how awful that would be. But, you know, money talks. So, yeah, we continue to file legislation. One of the things, you know, the Health Policy Commission put their thumb on the scale just a couple of weeks before the election and said, oh, that this would cost $1 billion. So now our strategy right now is we're introducing legislation to say, okay, you think this is going to cost so much money and that health outcomes will deteriorate? Let's do a study. Let's look at it. We're kind of like trying to approach it the same issue. Like if you come up with the answers that, you know, and it's, I mean, you know, anybody knows it, and certainly in the pandemic we saw it, that, you know, if you have 5 patients versus 7 patients, you know, there's less care, there are more falls, there's more pneumonia, there are worse outcomes. So we're saying, all right, let's look at the data, let's do a study around state, and let's see if we can come up with a solution. So yeah, we're never going to give up on this, never, because we will prevail eventually. You know, we will.
Yes, I don't know if this question was already asked, but going back in time, what we used to say about union buses, there was a term called scabs. And as long as you can be replaced by scabs, I don't see a lot of success, and that's what the unions have been brought down across the country. And these people are willing to step in and disregard your well-being, which are fellow nurses.
Yep.
What or anything is being done, I don't know if they still use the word scabs, it's so offensive, but that may be appropriate. But what is being done, so because all they're allowing you to do if they have scabs is to retire or to resign. So action or any legal action are taken against these people who are taking the jobs.
Thank you, and they're still called scabs. There are people on the line wearing T-shirts that say, you know, scab tactical attack unit or something like that. Yeah, pass the PRO Act. You know, the protection of the right to organize. I think that, you know, that is, I think that's the most, you know, wide-ranging and I use the word progressive loosely, legislation that would, you know, give workers greater rights to both organize and protect us in these situations. So, you know, you can imagine, you know, the opponents lined up to fight the PRO Act. But if we can see that passed into law, I think that will strengthen the work we do and address some of the issues that you're talking about. But yeah, it's, and it's of course in, you know, in absolutely every industry, but yeah, it's, you know, created a very unsafe situation, but there they go. Tenant hires them and brings them into the hospital. Thank you for that question.
Hi, Katie.
Hi.
I'm Andrea James from Families for Justice as Healing and the National Council for Incarcerated and Formerly Incarcerated Women and Girls. I am not going to miss this opportunity, Katie, to say thank you to the nurses. When we fought to pass ending shackling of pregnant incarcerated women, it was the nurses who made sure that after all the work we did to get that passed, when they still refused to actually acknowledge that there was a law that precluded women from being shackled during labor and delivery. It was the nurses of Massachusetts that stood in that gap and demanded that women be treated with dignity. We have never had the opportunity to say thank you to nurses and how much you really have helped us to advance dignity on behalf of incarcerated women. So I just want to not miss this opportunity and to say thank you.
You are wonderful, Andrea. Thank you. The work that you did was so important, right? That's so important. And it was wonderful to partner with you. Thank you. Thank you so much, Andrea. That's even thank you so much for addressing it. You know, that was really a population without a voice, really a population without a voice. And you stood up and spoke for those women. So thank you, Andrea. Thank you so much.
We'll take one more question and then we'll proceed on, but I think Katie will be around here for quite some time, so there will be an opportunity to dialogue with her in case you have some additional questions or if some bubble up. But we'll take one more question and then we'll proceed on. If anyone has any questions, don't everybody raise their hand at once.
Thank you, Brother Vernon. Hi, Katie.
Hi, Jared.
I was waiting to see if anyone else had a question first, but I'm curious. So other than a change in labor law, because we do need to pass the PRO Act, you're right, and other than saying organize, which we always have to do, no matter what the circumstances and conditions, what do you think we need to do here in Massachusetts to build a stronger, more robust, more muscular militant labor movement that wins demands for the common good for social, racial, economic, and climate justice for all?
I wish when you found that answer, you would like put it in a bottle and then send it over to me. Because you know what, you're really right. There are more of us than them. You know what, we are on the right side, fighting for the rights of everybody just to be healthy and in a safe environment and in a clean environment and have just laws. You know what, I think we continue the work that Mass Peace Action, people like Mass Care, people like Labor Campaign for Single Payer, all the umbrella groups that are walking around doing the work. As you know, it's probably one conversation at a time. And I think what a lot of us are working on, around the clock, I know certainly you are, Jared, is working for more progressive voices, in our leadership on Beacon Hill and in the United States Congress to finally, have this nation, this Commonwealth, live up to its image. Thank you.
Thank you.
Thank you all for everything that you do, everything that you do.
All right, thank you so much for that wonderful message that resonated with us on so many different levels, and I would imagine so many people here that the message resonated on so many different levels. So thank you so much for that. The energy it radiates the room. The ebulliency radiates the room. So we're now at an exciting portion. I mean, the whole program has been exciting, if you ask me, but we're at another exciting segment of the program, and we mentioned it a little earlier, that we are at the awards and awardees. So we have some outstanding awardees, we have some outstanding awarders, and we have some outstanding people here. That means you. So at any rate, so I have the privilege, I'm going to call up Claire and Yoav. Claire and Yoav. And forgive me if I'm saying that name wrong, but Claire and Yoav, can you come to the mic? We are requesting your presence. And they're going to present our first award.
Well, I'm here just to briefly introduce Andrea James, and we are awarding Andrea because of her work over many, many years. I think you can hear me better now. I first heard Andrea speak, I think it was around 2013 or so. There were a lot of conferences going on. She was the executive director at Families for Justice is Healing. She founded this with her sisters in Danbury, Connecticut while she was there in a federal prison. And since then, of course, she's also been founder of the National Council for Incarcerated Women, Incarcerated and Formerly Incarcerated Women and Girls. She shares a very clear vision and commitment to free incarcerated women and girls and to challenge the punitive criminal injustice system. As we heard along the walk that we just did, it's personal. It's very personal. The women who have been through this, they know what it takes. They're doing a lot of work around clemency as well. So she fosters empowerment of the incarcerated and formerly incarcerated women and their families. And along the route, a number of us who were there, and perhaps some of you who might have seen some of the footage online, we heard some of the stories of the women and the deep insights that they had. They really know what's wrong with the current system and that it isn't one that does any healing. And they have great ideas about alternatives that can really make a difference, can build healthy and thriving communities. They've done a lot of work on this, but it doesn't get the publicity that it really needs. So we have a lot to learn from Andrea and other women involved in this work. And Sashi's back there, Llewellyn Lambros is back there, and there's a lot of other women who've been involved. So I will turn this over to Yoav, who was very involved in the planning for the walk.
Thank you, thank you. Hi, everybody. Nice to see you. Well, we walked 35 miles from Springfield to Boston. Some of the participants had these fancy watches and they could tell how many steps they do every day. They were very excited. So I thought I'll check online how many steps is 35 miles because I walked all of it. So basically, it's about 70,000 steps that we do. So that was great. That was great. I could say that very briefly, the walk was an amazing experience. We met with hundreds of people in walking, in cars. People came from the streets, from their homes to see us. There was a beautiful act of kindness toward us and support. And that was really great because most people do not know that the state is planning to build a $50 million new prison for women instead of investing it in the community, yes? So that there's no need for the prison. So people don't know about it. So that was one great thing. The other great thing I will mention is that great in a negative way somewhat, because in the rallies, we heard the stories from the women who were formerly incarcerated. And I want to tell you that it is heartbreaking. We have a brutal system. It's a machine of torture. It's a machine of punishment. And we need to stop it. We need to stop this machine. Yeah. And you hear, and I realize really for the first time in my life that it's not just the women in prison who are suffering. It's their families, it's their children, it's their grandchildren, it's the community losing the potential of a bread earner, single mothers in prison. What's happening with the children? There was a woman who's 40 years old. She was, I don't know, 5, 6 maybe when her mother went to jail. In 30 years, nobody ever called them from the state to ask how the children are doing. Do they need any support? Do they need any help? It's a brutal machine, and we're gonna stop it. Now, another good thing in the walk is that it gave us opportunity to meet each other and talk and collaborate, yes, and plan ahead.
And we need your help, because without your help, we will not be able to stop this machine. And we are engaging now in a campaign to convince senators and state representatives to support a bill of a moratorium of 5 years of building new prison. Yes? But we need you. We need you. You know, this machine is fueled by money, and there is a lot of money there. It will only be people power, us, that will put the sticks in this machine and stop it from running. So please help us. I'm going to distribute in each table information about the petition so that you can participate. Call your representative, sign the petition. We can do it. It is such a stupid thing to waste $50 million of public money that I think we can do it, not to mention the torture that this money is used for instead of positive purposes. So another benefit of the walk is that I was able to work with the fantastic women like Andrea and Sashi and Llewellyn from the National Council of Incarcerated and Formerly Incarcerated Women. So it's a great pleasure for me to invite Andrea to receive our awards. And we will work with Chanti. No new prison. No new prison. No new jails. Invest in our community. Support the moratorium bill. That was our chant. Please remember, we need your help. We cannot do it alone. All of us need to get involved with it. Thank you, everybody. Thank you.
Thank you so much. I remember many years ago giving a presentation in this space about something. I think it was the primary caretaker bill, trying to get that passed, which we did. And we're gonna get this prison and jail construction moratorium bill passed as well. It's a 5-year moratorium. It gives us a moment to breathe, to continue to build what different looks like. Massachusetts has one of the lowest incarceration populations in the country of women. There are currently 135 women incarcerated in the state prison at Framingham. We can do so much better. In the past 10 years, since I came home, I'm a trial lawyer who went to prison for wire fraud. I was a criminal defense attorney, and I went to prison in a federal prison 2 states away with my children. That's my daughter back there, one of the baddest organizers on the planet. You mentioned the number of steps we were taking, but it's actually been a really long march to justice for us. When we came out in 2011 from that federal prison, I didn't think the alchemy of all the personal and professional experience that I've had. I assure you, if you are a criminal justice professional, so was I. I was a lawyer, a trial lawyer, a criminal defense attorney. I thought there wasn't much somebody could tell me about the state of incarceration in the criminal justice system in the Commonwealth of Massachusetts. I live still in a house where my family in Roxbury has been for 5 generations. Told Mary that my grandmother broke the color barrier as the first Black nurse at Boston City Hospital. And she bought that house. And 5 generations, my grandbaby Sasha's daughter, Tori, lives in that house. And it's the most incarcerated corridor in the Commonwealth of Massachusetts, in Roxbury. And so I have this alchemy of professional and personal experience that makes me an expert. And I assure you that what we are doing in the Commonwealth of Massachusetts is what we should not be doing and not what is best. And so please, we have spent 10 years at Families for Justice as Healing and the National Council creating what different looks like. And Massachusetts is uniquely poised because we are one of the lowest incarceration populations of women in the country. If we, with all of the brilliance, even just in this room, cannot figure out what different looks like for 135 women, because when you talk about building a new women's prison, darn it, you're not talking about Newton. You're not talking about outlying communities. You're talking about my neighborhood. You're talking about my children. You're talking about the little black and brown baby girls in the most incarcerated neighborhoods in the Commonwealth of Massachusetts. And if we don't care and have the opportunity to shift $50 million someplace else, then shame on us. And so please know that when I appeal, I am talking from a place of being an expert. Governor Baker is not an expert, not in this space. He doesn't know what I know. He does not know what I know. The legislators, you cannot have a felony conviction and serve in the state legislature in Massachusetts. There's not one legislator that has more experience than I have. And I implore you, please give us a chance. Give us this 5 years to just pause and not have to be up there fighting a new jail or a new prison so that we can get some real justice as healing. So I thank all of you. Thank you. There's so many faces in this room that have been with us for so long, just showing up. Dorothy, where are you, Dorothy? Our dear Dorothy. I mean, there's so many women that I can look back 10 years and they were sitting and listening and trying to help us. So I thank you for this award. I'm really asking though, please help us. Move these legislators. We are woefully behind in the numbers that are willing to support this bill. We need to get this across the line, and it's only going to take, as Yoav said, the power of the people. Thank you very much.
All right, that was moving. Thank you so much. We're going to now call up Cole, and just a reminder to all the recipients, you have 2 to 3 minutes, and we'll give you a countdown. We'll give you a countdown with 10 seconds to go, and then we'll hand it off to Cole.
Thank you, Vernon. The struggle for solidarity with Palestine is one of the most critical ones for the peace movement. Never was that more clear than this year when the Israeli occupation of the neighborhood of Sheikh Jarrah in East Jerusalem became a critical flashpoint, and it escalated into conflict, and Israel went military in its punishment of Gaza, and then all of the elements of Palestinian society, from the 48 Palestinians to the West, to the residents of the West Bank, to the Gaza, to the East Jerusalem, to the diaspora, joined together to challenge Israel's hegemony. We are concerned that the US has its finger on the scale, that the US is not a neutral party, that it sends military aid and provides diplomatic cover for Israel. And that is what we need the United States to change. We're here today to recognize an organization, BDS Boston, that has stepped forward into this breach to honoring the struggle of the people of Palestine with the nonviolent struggle for boycott, divestment, and sanctions. When in the spring they joined with others during the height of the conflict in Israel-Palestine. They organized a rally with more than 5,000 people in Copley Square that shook Boston and put everyone on notice of how important this struggle is. And then when Senator Markey wavered in his objectivity and said that Israel has the right to defend itself without pointing out that Palestinians also have the right to defend themselves, they challenged him, and actually on Monday, some of us and some of that group and others are going to join with the letter delivery to follow up on that. So I want to call up Marilyn Frankenstein, who's a member of BDS Boston, and thank them for their steadfast work. Somebody take a picture of us. I guess the video will do it. Let's just step forward. All right. Are we sweet? All right. Congratulations. Thank you.
Down for a moment. Can you hear me?
Yes.
I was supposed to be here with another member, Leah Hannah Kyali, but she was ill and she couldn't. I'm coming from one of our tickets at Puma, which I'll say a little bit about for the end. That's a particular international campaign that we're in. But first, I'm going to read you Leah's remarks and then tell you a little bit about the Puma campaign. First of all, we both thank so much to MAPA for this recognition, for understanding that the struggle for Palestinian liberation is connected to all the struggles for our liberation. And we need to really...
Hold closer.
Can you hear me now? Yeah. Oh, okay, sorry. We just, I'm thanking you for understanding the connections between the struggle for liberation in Palestine and all the social justice struggles. And we need to make that clear all over the place, that there's no such thing as being progressive if you're not for Palestine. I'm just going to read Leah's remarks, MAPA's, which I totally agree with, but she says it better than I can say it. MAPA's work, challenging war hawks and building a strong anti-war movement locally is critical to making our world safer. And then Leah was saying whenever she speaks to her family and friends in Palestine and elsewhere in the Middle East, they urge her to get my government in line. And then she said, kind of a joke, she always responds, we're trying, but maybe now she's going to give out MAPA's website to show what we're doing. This work is so important because anti-war work is anti-racist work. Because, as we all know, the war machine is built on racist narratives and colonial legacies. Build a world free of war and oppression is to decolonize our world and dismantle racist systems of oppression. It is core to liberation movements. For many of us in BDS Boston, this is personal liberation work as well. The racism and Islamophobia that fuels the war on terror and the occupation of Palestine ricochets off press podiums and into our neighborhoods. Structural racism creates personal oppression. As we know, this structural injustice is why Black and brown people are discriminatively surveyed, imprisoned, and deported. That's why it's so important for us to nurture the anti-war and anti-racism movement on many fronts, in the halls of Congress, in the virtual world, and in our streets. And we must build together as we are today in BDS Boston. We know that the liberation of Palestinians would be meaningless if it wasn't co-created with the liberation for Black people, Indigenous people, queer and trans people, and oppressed people globally. Which means we must continue to build with people of color organizing for their rights and dignity locally also. For us in BDS Boston, we believe that solidarity through struggle is the only path forward. And I'd say that when we had the Massachusetts Against Hewlett-Packard campaign that some of you know, we weren't just talking about Hewlett-Packard's hideous role in Israeli surveillance and with the Israeli military, like pass cards as from the South African experience, but also with ICE and with mass imprisonment that Hewlett-Packard was involved in. And today, we're a big campaign that we're involved in is an international campaign to boycott Puma. That's where we just came from a big picket. Today was the 5th day of action internationally against Puma because Puma has a contract with the Israeli Football Association, and in addition to many other things, that Football Association takes Palestinian land, builds stadiums, and does not allow Palestinian football players to play. And 200 teams in Palestine have called for this boycott. There are a number of actions you can help with. This is my final word. They'll be, I think, with Matthew's help, announced on the email newsletter, but there's petitions. We're going to start a campaign to call customer service in Puma, and we have monthly tickets, as well as we're thinking of other ways to expand this campaign to get Puma to drop its contract with the Israeli Football Association. So thank you very much for this recognition.
We'll move it right along. The next person I'll call is Fran. All right, and she will present our next awardee.
We can invite Asha to come up here with me. Nuclear ban US is committed to the abolition of nuclear weapons and a Green New Deal. Asha Sakan is accepting the Mass Peace Action Peace Builder Award on behalf of Nuclear Ban US. The organization's director since April of this year. Asha holds bachelor's degrees in law and master's degrees in international human rights law and international development policy. She worked for the Nonviolent Peace Force in the United Nations in South Sudan. What better preparation for facing our congressional representatives in DC? So you can present to you a nonviolent conflict resolution person working on our behalf. She's also a Rotary Peace Fellow, a member of the Rotary Action Group for Peace and Rotary E-Club of World Peace. Asha co-chairs the Working Group for Conflict Prevention, Peacekeeping, and Peacemaking with Women of Color Advancing Peace and Security, an organization you should be familiar with called WCAPS if you're interested. Really, really important group. Asha, I'm going to turn it over to you.
So good to see you all. I mean, I've seen many faces through Zoom, but it's really great to see you all in person. I really wanted to thank, on behalf of our founders, Vicky Elson and Team Awardees, the board members, our supporters in different states, volunteers, and partners like MAPA and many other organizations. For this honor, I'm really humbled and honored to receive this award. Nuclearban.us is committed for the total elimination of nuclear weapons, and we have been working on this issue at different levels, at the local level, state level, and national or the federal level. Both climate crisis and nuclear weapon are the existential threat to human rights. But I remember, like, a couple of years ago, nobody was giving much importance to climate crisis, but now we have started seeing the consequences of climate crisis. And people started getting panic. In the event of, like, we cannot wait for a nuclear catastrophe to happen to raise up and, be active and be serious about it. Because in the event of a nuclear catastrophe, even 1% of a nuclear weapon is used, more than 2 billion, millions of people will be killed immediately, and more than 2 billion people will be pushed to starvation. That's in addition to the climate crisis, aggravating the climate crisis. So we need to act immediately. We cannot wait to things to happen. I've seen in my personal life while working in South Sudan and in Sudan, 3 times I've seen the horrific impact of war and violence on civilians. It was horrific. And in the event of a nuclear catastrophe, there is no response mechanisms available. If you look into the ICRC or the Red Cross website, there are mechanisms or response plan for every other crisis, except for nuclear or a nuclear catastrophe. So it's high time that we need to respond. The ways you can respond is there are legislations, or there are bills in Massachusetts state legislature. Recently, we had hearing on 2 bills, Nuclear Weapon Commission bill and the Back from the Brink resolution. And at the national level or the federal level, there is one bill called HR 2850, which is introduced by Eleanor Holmes Norton. And it's about abolishing nuclear weapon and reallocating the resources to other important needs. So reaching out to your own members of the representative elected officials is very much required in this case. If you wanted to know more about it, there is an event that's happening on September 26th, which is the International Day for the Elimination of Nuclear Weapons, which is organized by MAPA, and it's both awareness raising as well as an action-oriented program or an event. So I really request everybody to attend that event. And if you have more questions about how can you support this campaign, please reach out to me or to MAPA, and I will definitely get back to you. And really, thank you so much to all the work all of you are doing in your life, and I really appreciate it. Thank you so much. Thank you.
All right. Next up, we will call Bonnie. Bonnie in the building? All right, Bonnie.
Here we go. This is Medicare for All campaign and healthcare not warfare. We have spent $21 trillion, that is $1 trillion, in the last 20 years on war. They could have been spent on healthcare and any number of other things. So keep that number in mind. We're asking you here, we're awarding a special award to Mass Care, and you have brochures on your tables, and I have a sign-up sheet here. If anybody would like to be on our mailing list, this is a bill at the state level that we have. 766 is the Senate bill, 1267 is the House bill. We're asking you to call your reps and senators and get them to sign on to Medicare for All here in Massachusetts. We also have a national bill that we're promoting, and you'll see emails through Mass Peace Action. We do thank Mass Care and Sandy Eaton, who is remote, and Stephanie Nakajima is here to accept the award. And take as many as you want, sign up for our mailing list. We need to get this passed at the state and federal level. We're spending $21 trillion on war. We could fund healthcare. And thank you.
This is my first communal activist dinner in a year and a half. I don't know about all y'all, but this feels so great. I'll never complain about going to an event again. Yeah, so thank you so much, Mass Peace Action, for this award. And hi, Sandy. I know you're out there. So, you know, the Medicare for All movement has taken such a huge leap over the last 5 years. You know, in 2003, Detroit Representative John Conyers introduced Medicare for All. So this 2003, he introduced it with 37 co-sponsors, right? And they were Dennis Kucinich, like, you know, back when Bernie Sanders was a rep. It was a small group, but mostly socialist defined people. And today, 2021, we now have 118 co-sponsors in the House. That's a majority of Democrats in the House. And we also have a Senate bill that Bernie Sanders has introduced from the last session, and that has 17 senators. And that's incredible, I think. And you know, I think that also, it's not just a matter of like how many co-sponsors we have or whatever. I think that this is having ripple effects, you know, through what we're legislating in Congress right now. So I don't know if y'all been paying attention to what's happening with the negotiation, spending bill and the infrastructure bill. Sometimes it's hard to watch as the lobbyists kind of move in and, you know, negotiate us down. But the fact that what we have on the table right now for healthcare, which is an expansion of dental, vision, and hearing benefits to traditional Medicare, lowering the age, for example, putting an out-of-pocket cap on Medicare. These are things, this signals a shift in the way that we are thinking about healthcare reform in the whole country, what is actually acceptable. Because when you, we were actually just doing we have a Medicare for All podcast at Healthcare Now, sorry, I work at Healthcare Now, by the way, I didn't introduce myself, but work at Healthcare Now, and I'm about to actually take over at MassCare as the executive director, but we did like a review of all the health reforms that have happened for Medicare over, you know, since it was established in '65. And the last time we had a real expansion of traditional Medicare was in the '70s, when we, you know, included people with disabilities and some rare diseases into the Medicare program. And ever since then, it's all been privatization, you know, private Medicare option, private Medicare drug prescription thing, you know. This is a turning point. This is saying we're going to start investing in public Medicare. So, you know, if you're ever feeling down about like how Medicare for All is doing, just remember that we are actually making progress, even if it's not on the table right now. We are going to slowly get there. And I think that that's actually also having ripple down effects into Massachusetts. I mean, we're seeing a lot more legislators not able really to say that they're not going to sign on to this bill, and really taking the heat. I love seeing Joe Kennedy and Ed Markey argue about who sponsored Medicare for All first. That was a high point for me, that campaign. And so, you know, and now we have in the Massachusetts Senate, or the Massachusetts legislature, we have 70 reps who are co-sponsoring, 70 reps and senators who are co-sponsoring the bill. And many of them are first-time reps, you know, coming into the legislature for the first time and hopefully bringing a more progressive, you know, politics to Beacon Hill. And so, you know, I encourage you to get involved, and we actually have a very short call to action. You can't get to a room back this without having a call to action. October 26th, the Massachusetts Medicare for All bill will be heard by the Healthcare Financing Committee in Beacon Hill. And they don't want you to know about this because they don't want you to show up. But we really need people to turn out to watch. You can submit written testimony. And you know, if you're interested in that, then we would love to hear your testimony. If you have a great healthcare story, then you can email MassCare, you can email me. I'm Stephanie. Oh God, I don't have a MassCare email address yet. You can email me, stephanie@healthcare-now.org, or you can just email like whatever the MassCare email is and look at it. And so yeah, if you're interested in that, please keep up with MassCare. The mailing list will let you know exactly what time. We don't have a time yet for the hearing. We don't exactly know what it is, but it's going to be October 26th. And so thank you so much again for all this, and so good to see you all again.
All right.
All right. Next up, we will call Rosalie Anders, and then following that, following this presentation, our last presenter will be Brian Gardner. So we're gonna follow Rosalie.
So, hello. So to create the mighty movement we need, we have to keep strengthening our understanding of how all the issues that we care about are connected.
climate, the war machine, racism, social and economic injustice. But how to build that movement collaboratively while remaining focused on our organization's priorities is really a dance whose steps we are all still learning. So 350 Massachusetts, which began in 2012 to act on the climate emergency, has been a model of understanding this. Its democratic structure with, I think, it's 17 local groups and a bunch of working groups is one key because they allow the membership to set the agenda. 350 Massachusetts has held marches, protests, stand-ins, sit-downs, vigils, and rallies to build movement power. It's no accident that many of our MAPA members, including the amazing Diane Fine, are part of both 350 and MAPA as we raise awareness of how our US military posturing undermines the international collaboration that is absolutely required to deal with the climate emergency. And also how growing climate chaos can give rise to militarized authoritarian responses here and elsewhere. So thank you, 350 Massachusetts, for your great grassroots work. And Diane, thank you for your leadership in both our groups.
Hi, everybody. My name is Alan Tom. I'm the interim executive director of the Better Future Project, which supports 350 Mass, along with crew, communities responding to extreme weather, run by Reverend Walker here, and a program called Divest Ed that works with college students for fossil fuel divestment on college campuses. So we're really grateful to have this award, to be recognized in this way, and really for the leadership of Mass Peace Action and all the other groups who are here. There's so much wisdom that's been expressed in this room about the interconnectedness between our issues. And there's so many ways that climate change and war are inextricably linked in their root causes that are both caused by institutionalized greed and their compounding impacts as resources get more scarce. So sort of that heightens the conflicts over them, and profoundly in their shared solutions. So 350 Mass members are fighting for the vision of the Green New Deal. We are paying attention to those federal budget resolution talks very closely and see that as a down payment to get the resources that we need to invest in the infrastructure that is essential, and we will create millions of good jobs in the process. Here in Massachusetts, 350 Mass has co-founded, along with partners from labor, environmental justice, indigenous rights groups, a coalition called the Mass Renews Alliance, where we are working to bring the vision of the Green New Deal here to Massachusetts. We've introduced a bill called the Building Justice with Jobs Act that seeks to retrofit 1 million homes over the next 10 years for both environmental remediation and climate impacts, creating thousands of good jobs in the process and starting with the communities who need it most. Those are environmental justice communities. And we need this federal money to make that happen. And I think in regard to shared solutions, whether it's the trillions of dollars that are wasted on war or through the private health insurance schemes or through the prison industrial complex, if we can legislate our values and see those represented in policy, we will have all the solutions that we need. And I want to turn it over to my friend Diane Fine. And another one of the ways that the links between our issues are manifest is through people who embody and act on the commitments that bring them together. So Diane, I'm really grateful to your leadership. We're both on climate and peace, and turn it over to you.
Thank you, Alan. I echo everything Alan said, and I want to thank Alan for inviting me to be up there with him. And I want to thank Mass Peace Action for recognizing, can everyone hear me? For recognizing 350 Mass as a partner in peace. I started off actually in the peace movement a long time ago, detoured around and came to the climate movement. And I've been with 350 Mass for a few years now. And last summer I was asked to represent us at MAPA's, I think it was their first conference that was jointly sponsored or jointly organized by progressive organizations. And it didn't take me very long to feel at home there as well as at 350 and realize we needed to work more closely. And I really feel like we're more than allies. I feel like we're kind of woven together by threads, like you talked about, colonialism, militarism, we're woven together and into what has catapulted us into the two existential crises of our time, the climate catastrophe and the threat of nuclear war. So obviously I didn't leave MAPA. I stayed on it for places. And I've been working to bring more collaboration. That's something that's very meaningful to me and really important. And I just want to tell you all that I'm really excited to say that MAPA and 350 Mass are going to have 2 joint webinars. That we've worked on, both members from both groups have worked on, and it'll be presented by MAPA's own Nick Rabb, opposing militarism, a key task for climate justice, and that'll be October 16th and the 23rd. So look out for the announcement, join us. Nick is wonderful and I'm excited about it, so more people the better.
I think now we have Brian, and our last award, presenting our last awardee.
Thank you, Vernon. I'd like to invite up someone who's been fighting for an incredibly important cause for a very long time, and that is the Executive Vice President of the Boston Teachers Union, Eric Byrne. Come on up, Eric. Now, Eric, before he took his current role, taught elementary school students for 25 years. He is on the front line of educating the next generation, and now he's fighting so those students and their teachers have the resources that they need to invest in the next generation. Eric, I'm pleased to present you with the 2021 Peace Builders Award. Thank you.
Thank you, Brian. Thanks to Mass Peace Action. Really humbled and proud to be a part of the labor movement that is standing behind the peace movement, and really happy that all of us here tonight, along with our sisters and brothers in the MNA, and many of us in the labor movement, are keeping the flame alive for peace in our world and a more just society. And I think it's something that we don't think about enough. And it's thanks to groups like Mass Peace Action and many unions and others in the movement that are making us think about how our tax dollars are spent. And the 21 trillion that my sister mentioned earlier is something that it's so large, you get enough zeros that it gets incomprehensible. But I think people need to remember and think about where our tax dollars are going, because Lord knows our children, our healthcare workers, our healthcare facilities, our schools, our higher ed institutions need those dollars a lot more than the bombs and the bombers need to be purchased. So thank you. I just want to mention that the Boston Teachers Union, we recently signed an agreement to open our schools in Boston in as safe a way as possible. It's not perfect. Nothing is perfect in the pandemic that we're living through, but we think it's the safest way to reopen our schools. Our contract has expired. We're back at the bargaining table. We're going to be fighting for better special education staffing ratios, more supports for English learners, housing supports for families who are experiencing homelessness, Green New Deal for Green New Schools. We have 123 school buildings in the city of Boston, 123 school buildings, and all this talk about ventilation, well, 35 of them have an HVAC system. The other 88 have radiators and windows. So talking about upgrading the filters in the HVAC system isn't even relevant. So we need new facilities. We need green new facilities.
We need equity of access to programming and a broad curriculum for urban kids that kids around the Commonwealth take for granted. And these are some of the things we're going to be fighting for at the bargaining table. And when the time comes, we'll be asking for your help, and hope that you will stand with us. Thank you very much. Appreciate it.
Thanks, people going there.
All right, all right. What a wonderful night so far. Now we're winding down. We won't keep you long. Someone asked a question in their mind, although I don't claim to have telepathy. Someone asked the question, well, when is this program going to be done? And you know, my reply to that is, we're going to be done as soon as we're finished. And as soon as we're finished, we'll be done. So at any rate, we are here not only to gather people together from so many different walks of the social justice movement that are doing extraordinary work in Boston and beyond here in Massachusetts, but we are also here, and also our friends, our brothers and our sisters and folks of goodwill on Zoom. We don't want to forget about them, but we're also here because this is a fundraiser. Look at your neighbor and say fundraiser, even if you have your mask on. Even if you don't like your neighbor. And we, you know, obviously everyone knows that it takes support, financial and monetary support to support organizations that are mission-driven, organizations that are about a good work in this world, and MAPA is no exception. So I'm going to turn it over to Brian, and he could talk about some of the things that we could use some funding for. And we would like for you to give to the level of your comfort. Now, if your level of comfort is $2,000, $3,000, $4,000, $50, $60, to the level of your comfort, we would love for you to give, and to give with a cheerful heart, knowing that MAPA would not exist without your partnership, and MAPA would not be the organization that it is without the members. Turn over to Brian to talk about perhaps some individual expenses, perhaps also some accomplishments that MAPA has undertaken in this last year and a half during this worldwide pandemic. So I'm going to turn it over to Brian.
Thanks, Vernon. And first of all, I want to acknowledge, excuse me, I want to acknowledge the people in this room, because Mass Peace Action is made up of all of you. So first of all, I want to recognize there were more of them here earlier, really working their butts off to set everything up so we could have this good time tonight. But there's three of them that are still with us. So I would love to recognize our interns. William, Jack, who's a former intern of ours. And they're making it happen. They've decided to dedicate their time and effort to make the world a more peaceful place, and to really explore the intersectionality of all the issues that we've been talking about tonight. So when you give to Massachusetts Peace Action, you're supporting their work. And they really have made a huge difference in the work that we're doing. We know that our movement needs to get younger, and they're helping us do it every day. They're learning new skills. We have put out, for instance, more newsletters and articles based on peace and the need to fight climate change and the need for healthcare for all. We put out more editions of our newsletter than ever before, and that's a project of our interns. Our interns are leading that. Yeah, give them another round. They're redesigning our website. They're making it more modern. They're bringing us truly into the 21st century, so to speak. Dragging us, kicking and screaming. But when you give to Massachusetts Peace Action, these are the kind of things that you support. Here's another thing that you would be supporting. we just added another full-time staff member. He couldn't be here tonight, but I'm sure many of you have seen him on Zoom meetings, Amar Ahmad, our new organizer, right? You all know Amar, right? He has completely revitalized the way that we do peace education through the webinar program, right? I'm sure many of you have seen that 2, 3, even sometimes 4 nights a week, we're putting on educational programming. And that is, along with the advocacy and the action, education is a key part of our work. Because, you know, you don't hear about how much we spend on our military budget from the mainstream media. You know, you don't hear about the true costs of war from the corporate media. You don't hear how war and militarism is connected to all these other issues from CNN or MSNBC, or certainly not Fox News. But I just, one more time, he couldn't be here tonight, but I think he may be watching on Zoom. One more time for Amar and his webinar program, which has been absolutely fantastic. Let me just tell you that because we've gone digital, you know, we didn't really know how this was going to work. We were unsure at the beginning of COVID. Well, you know, what's the future going to be like? And I'll tell you, over the last year and a half, we have grown faster than ever. Our reach is greater than it has ever been. Our contact list doubled. And I'll tell you right now, hundreds of thousands of people have seen those webinars. So, and that really has a lot to do not just with the interns and the staff at Mass Peace Action, but it has a ton to do with our activists and our volunteers, because we are truly a grassroots organization and we rely on the support of funds and time from our volunteers and our activists. So please, one more round of applause for all the people who volunteered their time. Support their work, honored and privileged to be able to support their work. And I'd like to recognize a few more people. So MAPL board members, I know there's a few of you in the room. We have a working board. If you're a member of the Mass Peace Action Board, please stand up and get a round of applause. Okay. If you're a member of the Massachusetts Peace Action Education Board, please stand up. Levi, I know you are here. If you are a member of a working group, our working groups are incredibly important. If you're ever looking to get more involved, consider joining one. If you're a member of a Mass Peace Action working group and you're in this room, stand up right now. Mass Peace Action. That's where those ideas come from. So, as Vernon said, this is fundraising dinner. So I'll give it to you straight, right? We've taken on a lot more work. We've taken on a new full-time staff person. We've taken on more interns than we've ever had before. We're doing more work than we've ever done before. More lobby visits than ever. You know, we really are drinking from a fire hose, and that requires support. So right now we're at about just shy of $120,000 that we've raised over the course of the year, and we're looking to get to about 215 by the end of the year, and this is the giving season. So this event tonight is really the launch of the fundraising season, and we need support to be able to keep doing this work. You know, the military-industrial complex, they have billions of dollars, and they have an army of lobbyists, and you know, we're trying to raise $250,000. One of the best organizations. We We do a ton of work and we are making a difference. Our legislature, our legislators, our members of Congress, when they do the wrong thing, they hear it from us. And we've been able to move them quite a bit. You know, I think they're a little wary to take pro-Pentagon and pro-militaristic votes. And that has to do with the army of people that we have behind us, including you. So with that, I'm gonna pass it over to Vernon. He's basically gonna hold you upside down and shake you and see what happens.
Not necessarily. We're not gonna shake the tree.
I'm kidding.
But you know, no worries. So one of the motifs that has commonly come up throughout the night is intersectionality and how these issues are intersected with peace, education, climate, healthcare, etc. And I am a believer that in our collective solidarity is redemption. And we certainly do have historical precedents to show that when people come together from diverse walks of life, black, white, brown, gay, straight, people of faith, people of no faith, come together around a moral cause, then systemic and radical change happens. Certainly we see the civil rights movement, we see the abolitionist movement, we see the women's suffragist movement, and we can go on and on and on. But the reality of it is that these movements, you know, required funds. So if for folks on Zoom, there's a link if you want to give. Perhaps Brian can help me if you are compelled to give here, and we'd like for you to give. But if you want to make a pledge to give, we have these pledge cards, and again, we are not going to ask for a specific amount, even though we have a specific amount that we're trying to raise. But we want to keep you involved, and we want to have you give to a level of your comfort. So, so Brian, are you going to pass these out here, or folks to
Sure,
folks that want more?
I would love to. If you would like to make a pledge, you know, please stand up, and myself or one of our interns will come over and pass this pledge card to you, and please give what you can to support our work.
And we're gonna have some music coming up in just a second. We're gonna have our wonderful musicians come up, so we get some jamming music. And I don't know how many people in this room, we are in the church, but how many people in this room know the principle of reaping and sowing? And if you sow into a good work, you shall reap a harvest. But in order to reap that harvest, if you sow with a cheerful heart, blessings will come in a manifold of ways. And certainly the windows of heaven will be opened up, and blessings will flow down that you couldn't even receive, can't even count. That's a blessed place to be when you're in a place where the blessings are just overflowing and running like water, and you can't even count it. How many know what I'm talking about? And if you don't know what I'm talking about, you woke up this morning. That's a blessing in itself. I know some folks didn't want you to wake up this morning, but you woke up this morning. You know, I know your haters didn't want you to wake up this morning, but you woke up this morning. So that's quite all right. The military-industrial complex didn't want you to wake up this morning, but you woke up this morning. So at any rate, so we have these. Can we get some music going? If you raise your hand, we'll get these to you. We'll get some music, and then they will. This will conclude the program, unless we have anything else to say.
Do you take Venmo?
Do we take Venmo?
Yes, we do.
We take anything. Cash.
And just as Jenny and Walter set up, I just want to thank everyone for your support. I want to thank you for allowing me to do what I do. I couldn't do it without you. And let's be frank, we're trying to change the world. You know, it's not small what we're trying to do, but we believe that together, if we stand in solidarity, we can truly make a difference. So I want to thank you all for coming out tonight. And with that, I'll turn it back over to Jenny and Walter.
Thank you so much. We are Jenny and Walter. Actually, I thought we needed to give you a little bit of background. Jenny and I have been collaborating together at events like this for the past few years. And this was just so, this event today was so invigorating, because it really is about coalitions. Coalitions, and that's what Jenny and I focus on. we have established a ministry, if you will, to support interfaith coalitions, because that's really where the work is done. But you know what's primary to coalitions? Because coalitions are about a group of people getting together. But the vital thing about coalitions is what Vernon talked about, the individual. What we do as individual, I think it starts with caring. First you have to care. And then the next question is, well, what can I do? And all of you have faced that question, and all of you have answered that question because you stepped up, because you're involved. And the way individuals can get involved, sometimes they can't be involved proactively in the actual issues and negotiating those issues. But they can be supportive through their donations. And sometimes we interpret those donations really as being an act of love and a way to let our light shine. So we're going to close with this song. You know this song. It says, "This little light of mine, I'm going to let it shine." And that's something that we all individually have to determine to do. Because when we can do that individually, but take all of our little lights, if we can get enough of those little lights together, we can create a great light. And that's what we're all about. So we want to invite you all to dig down, dig deep, let your light shine. Because it's the shining of that light of love that is really the solution. The solution for all of our issues are wrapped up in our ability to love one another. So we invite you to sing this song as we prepare to close. This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine, let it shine, let it shine, let it shine. Everywhere I go, everywhere I go, don't you know, I'm gonna let it shine. Everywhere I go, I'm gonna let it shine. Everywhere I go, I'm gonna let it shine. Let it shine, let it shine, let it shine. In the midst of confusion, I'm gonna let it shine. Well, in the midst of confusion, I'm gonna let it shine. In the midst of confusion, I'm gonna let it shine. Let it shine, let it shine. Let it shine. On my way to the ballot box, I'm gonna let it shine. On my way to the ballot box, I'm gonna let it shine. That's where our power is. On my way to the ballot box, I'm gonna let it shine. Let it shine. Let it shine. Let it shine. Black lives matter. I'm gonna let it shine. Well, black lives matter. I'm gonna let it shine. Black lives matter. I'm gonna let it shine. Let it shine. Let it shine. Let it shine. All over social media. I'm gonna let it shine. Well, all over social media. I'm gonna let it shine. All over social media. I'm gonna let it shine. Let it shine. Let it shine. Let it shine. On mass peace actions dinner, I'm gonna let it right here. On mass peace actions dinner, I'm gonna let it shine. I'm gonna let it shine, let it shine, let it shine, let it shine. Walking in light and living in hope. Walking in love, living in hope. I'm gonna let it shine, yeah. Walking in love, living in hope. I'm gonna let it shine. Walking in love, living in hope. I'm gonna let it shine, let it shine, let it shine, let it shine. One more time, this little light of mine, this little light of mine. I'm gonna let it shine, oh, this little light of mine. I'm gonna let it shine, this little light of mine. I'm gonna let it shine.